First, good news is that Texas now has the ability to test for COVID-19. State testing is conducted by public health labs throughout the state that are a part of what is called the Laboratory Response Network. There are 10 public health labs within the Laboratory Response Network in Texas. The labs are in Lubbock, Fort Worth, Dallas, Tyler, El Paso, Austin, Houston, San Antonio, Corpus Christi, and Harlingen. The Laboratory Response Network provides laboratory diagnostics and responds to biological and chemical threats as well as other public health emergencies. The labs that are online as of today and can perform the COVID-19 tests are at the DSHS site lab right here in Austin and the public labs in Houston, Dallas, El Paso, Lubbock, and Fort Worth. The remaining will be online by the end of this month. The state lab can perform approximately tests for 26 patients per day. Houston and El Paso can perform tests for approximately 15 people per day. Dallas and Lubbock can perform tests on approximately 10 patients per day. Once the other public health labs in the state complete the testing validation process and begin testing, the State Public Health Lab Network will be able to process more than 125 COVID-19 tests per day. The COVID-19 test includes a nasal and oral swab taken from the patient. The local public health department then coordinates the shipping of the specimens to the closest public health lab for processing and testing. This new ability to provide testing in the state will shorten the time to get the test results and will help public health take the appropriate steps. The first case of COVID-19 in Texas, outside of the repatriation efforts that were carried out in San Antonio, was announced Wednesday in Fort Bend County. It is our understanding that the person was exposed to COVID-19 while overseas on a trip and did not contract the virus in Texas. We anticipated cases like this arising, and we continue to collaborate with local and federal partners to remain prepared to respond to any future cases of COVID-19. If someone thinks that they may have the coronavirus, they should contact their doctor. The doctor should then contact the local health department to determine if testing should be conducted. All Texans have the ability to slow the transmission of this virus by doing simple things like washing your hands regularly, covering coughs and sneezes, and staying at home if you're sick.
We call it a novel coronavirus because it hasn't circulated in human populations before, which means there's no population that has a pre-existing immunity, which means that there is the potential for it to spread very rapidly. However, we have very powerful, very effective tools to combat that, and it's exactly the kind of, again, personal hygiene, cleaning, and sanitation that we've talked about. This is what your doctor and your grandma has been telling you your entire life, and it works. So even though this is a novel virus, it's a virus like other viruses, and the kind of things we're asking people to do work against every single germ there is, including the novel coronavirus. So we need to get together and work as a team. As Texans, we need to show the world how it can be done, and we can vastly slow down and mitigate the risk to our communities here in Texas if we all act together. I think it would be great for friends and neighbors and organizations to get out there and be visible in the way in which they're helping to combat this.